Hi everybody. Hey, I wrote down a few things because I wanted to do I wanted to make sure that I had all my P's and Q's in order because I wanted to talk about my breast reduction that I had about a year ago. And I went from a triple D into a full B cup. And okay, the first thing that you're going to have to do is like with my insurance, I could just get a hold of whoever. Like if I wanted to go to a plastic surgeon or if I wanted to go to just a regular doctor or whatever. I wanted to go to a plastic surgeon, so you have to make sure that insurance will pay for it. So make sure that you go to a board certified plastic surgeon. When you go to your board certified plastic surgeon, make sure that they are able to practice in their hospital. If they're not able to practice in the hospital in your hometown or your city, then usually that shows that they've had some neglect or they've had some malpractice suits against them. When you go to file the paperwork with your insurance company will make sure that it is medically necessary, and your doctor will take care of all that information. The things that they'll ask you are, do you have migraines? Have you had migraines? Have you been diagnosed with migraines? Have you had been diagnosed with back pain? Have you been treated by the chiropractor with chronic back pain? Have you are you on any medications for pain? Things like that. What I should have done is I went to a plastic surgeon. He was a board certified plastic surgeon, but the thing that I should have checked up on was how many breast reductions had he done, because I don't know how many he had done. And from the outcome that my breast looked like, I should have researched more. He had a PA, a physician's assistant, with him too. And I'm wondering how much of the surgery that she did, because I got charged for him and for her. Make sure you know how long you're going to be off work, because I only thought that I was going to be off work a few weeks, and I ended up off 7 weeks because I had necrotic tissue underneath. That's where the tissue is dying. And even though he said that it wouldn't deter the outcome, which if I showed you a picture of him, you'd be like, ugh. Anyway, so make sure you know exactly how many weeks you're going to be off. Make sure you know how long the drain tubes are going to be in. The drain tubes are the worst. I'm just telling you right now, they are the worst. They don't hurt when they're being pulled out, but they hurt when they're in. I had terrible scarring underneath my breasts, and the nipples to me are too small. They should have been larger. And I had necrotic tissue, which I had to have abraded, where they go in and they cut the skin off, and you have to keep going back. You want to know how much the cost is? Mine was like $36,000. Make sure you discuss the size, what size you want, because you may want a B, but appropriate for your body shape. And if you go too small, you don't want necrotic tissue like mine. So he told me that if I would have went any smaller than a C, that I would probably end up with necrotic tissue, which He's a doctor. He should have been the one that said, no, we're only going as far as a C. Make sure that they have pictures. Usually if there's a plastic surgeon, they usually have pictures and you can see the before and after. And let's see, what else was I going to say? Just be really careful. I mean, really think it out. And what I should have done is I should have wrote out a bunch of questions that I should have had just right there that I could have asked him. You know, it was basically you're in, you're out, you know. And I should have spent more time on researching. But would I do it again? Yes, because I don't have the back pain like I used to, or the migraines like I used to. But I would probably maybe dive into it a little more, I think, and not just rush right in to get it done, because they're not pretty by any means. They're uneven. They were uneven before. They're uneven now. They're still numb after a year. They're still numb. I'm still numb underneath my armpits and on the tops of them. If you're wanting to breastfeed, you're going to want to really ask your doctor if you're going to be able to breastfeed. And just questions like that. But hey, if you like what I'm talking about, give me a thumbs up, subscribe, and leave me a comment, and I'll get back with you. Okay? We'll see ya.